Hello, good morning, good afternoon, good evening, wherever we are, all across the continent and across the world. You're very welcome to the fourth in the series of APF webinars on abstract preparation and submission. This very fine Friday afternoon, 31st January 2025. We are all very welcome. Bringing you this webinar is Professor Arinola Joda, the moderator from the University of Lagos, Nigeria, and I am currently one of the vice presidents and treasurer of the African Pharmaceutical Forum, and I'm also an executive committee member of the academic pharmacy section. You are all very welcome to this webinar. We are very excited to bring it to you. This webinar, some announcements. This webinar is being recorded and live streamed via YouTube. The recording will be available after the event on the FIP website, on the FIP digital event website. So you're very welcome to check out for it. You may ask questions using the question box. Please preferably help drop the questions in the Q&A box rather than in the chat if the Q&A box is open. And as usual, you're welcome to provide feedback to webinars@fip.org. If there are any special topics you would like us to address, if there are any things that you want us to look into around webinars being hosted by FIP, I will be glad to take your feedback. For those of you that are here, not yet members of FIP, we welcome you to join us, and you will do well by visiting the membership site on www.fip.org/membership registration. Again, we're all very welcome for this webinar. A new feature that FIP has just added on to their Zoom platform is the ability to be able to read captions in your own preferred language. So following the steps, you'll be able to do that. You turn on the captions as part of the settings of your Zoom template. You enable the translation toggle. Then you choose your preferred language under the My Caption language. I'm sorry if the language in your particular hometown or village is not there, but I'm sure you'll find a close substitute for one of the global languages that you can follow on with. So you can then follow along with live translated captions in your preferred language. And we welcome you, we ask you to try it so that you can give us feedback on that service. So our webinar today, as I mentioned, is on abstract preparation and submission, and we have a rich lineup of members to take on this topic. Today's program, we start, of course, with introductions and housekeeping, which I've just done. Then we're going to have our speaker for today, Dr. Jonathan Jato from Ghana, to talk to us, to give us an overview of the topic. And then we'll have abstract manager for FIP 2025 Congress, Ali Mubarak Salman, to give an overview from the FIP standpoint. And then we'll move on to the panel discussion, where we'll have members of different sections and SIGs joining us. Sorry, I forgot to apologize. We were to have Charlotte joining us to give perspectives from the Pharmacy Practice Research SIG, but unfortunately there was a clashing of the time zones, and she is no longer able to join us. But we have representatives from the hospital pharmacy, academic pharmacy, and then the health and medicine information section perspectives to be shared with us on this platform. And then we'll have a time of open discussion, question and answers, and then we'll close the webinar. So our learning objectives, because they say if you don't know where you're going, any road will lead you there. So we have specific objectives for this webinar. So at the end, we expect to have provided guidance on how abstract preparation should be done, starting from planning and conducting a study, provide experiences about the different section and SIG requirements for abstract submission, engage in a panel discussion with experienced abstract presenters and assessors from different sections. And then ultimately, it is our hope that this will result in significantly more abstract submissions from the AFRO region in future FIP congresses. So permit me to introduce our speaker, Dr. Jato from the School of Pharmacy, University of Health and Allied Sciences in Ghana. He's a pharmacist and lecturer, and he earned his BPharm, MPhil, and PhD degrees from the Kwame Nkrumah University of Science and Technology, Kumasi, with part of his doctoral research conducted at the University of Munster in Germany. He's a member of the West African Postgraduate College of Pharmacists and a member of the Pharmaceutical Society of Ghana, where he previously served as Secretary of the Academic Social and Research Pharmacists Association. Currently, Dr. Jato is the Vocational Training Coordinator at the School of Pharmacy. At the US School of Pharmacy, actively contributes to FIP's academic pharmacy section, serving as an abstract assessor and poster adjudicator. So you are in for a treat. His research interests include natural product drug discovery, antimicrobial stewardship, and neglected tropical diseases. He also spearheaded the establishment of the C. elegans lab at UHAS, where he's into advocating for molecular pharmacological research. So please join me in welcoming Dr. Jato to give his presentation. Dr. Jato, over to you. Dr. Jato. Oh, it looks like he dropped off. Let's give him 2 minutes to try and come back in. Otherwise, we'll move on. He's back.
So sorry, apologize sincerely for the network failure.
Very welcome.
I wish to thank you for this opportunity. I hope you can hear me.
Yes, we can, loud and clear.
Arinola, can you hear me?
I can hear you. Can you hear me?
All right, so thank you very much. As I have been introduced, I'm a faculty at the School of Pharmacy and have been working with the FIP for quite some time now, especially in the area of academic pharmacy section. And I'm happy today to present to you some of my thoughts regarding abstract preparation and submission. Next. So the objective of the webinar first is to look at our understanding of the components that are key for a strong abstract. We would also look at how to navigate and avoid some common mistakes when we are preparing abstracts. Again, we'll look at how to increase our chances of getting the abstract we prepare accepted. We'll look at how we can navigate the FIP submission process, especially towards the Congress, and also how we can get our abstract and posters to meet standards, especially for our assessors to maybe award us good scores so we can, at the end of the day, be a judge good poster and abstract owners. Next, please. So today, we'll find out that an abstract is just a concise statement of the major elements of a research project. Usually, the abstract states the purpose, the methods, key findings, and tries to give a line of action for future research regarding a project area. It is condensed and speaks about the entire scientific paper. So for example, if you write a paper, the abstract gives somebody the details of what is in the paper, and that helps an individual to just get forehand information without even reading the article. Next slide, please. And so what are the goals of an abstract? If you have an abstract, you want to share your research or a practice innovation, a policy perspective, or your abstract will end up helping you to have link and networking with others in your field, especially at congresses. You get the opportunity to share your research with others. They get interesting cues from it, and you link up and you create networks. Abstract also helps you to contribute to global advancement. They're just like scientific papers, but this is a condensed form of scientific presentations, and it strengthens your presence in the scientific community. If it's FIP, for example, you present an abstract, you get opportunity to meet people, and they get to know what you are doing. So what is the structure of an abstract? We expect that an abstract will have the following structure: that there will be a title, background or introduction, objectives, methods, results, and a conclusion. This is usually the formal structure. Even though conferences have specific requirements, they may add. If you take the title, it must be concise and engaging. It should not be too long, but not too short to be deficient in any information that is relevant to the subject area. The background should give people context of the research and the relevance of the research. You give specific and clear objectives so readers know what you set out to do and how you achieved it through your methods. And so your methods must state the study design, how the data was collected and analyzed. Then you present your key findings. In the case of results presentation, you must make the effort to present what is relevant and not all results. Sometimes you have a plethora of results, but you must present what is key, what is important, and what is impactful to your research. And you try to summarize that, especially because abstracts come with limitation of word count and spaces. And you have a conclusion. Your conclusion should be, it should indicate the impact of your research, the relevance of the work that was conducted, and give a line for future research so that people can, maybe reading through your conclusion, know the areas that there are gaps in to conduct research. Next slide. All right, so as an assessor or a reviewer of abstract, what do you look out for? The first thing is the structure of the abstract. And in terms of structure, we look at the logical presentation of the abstract. Then the next is the relevance of the abstract. If you present a scientific research that's not impactful, that doesn't contribute to science, then the abstract assessors may shoot it down. It must also align with the themes of the conference. Every conference has a theme and sub-theme, so you must make sure that your abstract is relevant to the theme where you are presenting it. Then originality and innovation. Your abstract should show some novelty in terms of your findings and in terms of research. Your method must be robust and also rigor. So you must show the exact procedures you use in terms of data collection, data analysis. Then again, contribution to science. You state the quality, and as an assessor, we look for the quality of the abstract and impact on scientific community. So we look at the results. Are the results impactful? Are they well presented? Are they applicable in terms of the real world? In terms of scientific quality, are you using the right terms? Are there errors? Are there jargons? Because you are presenting to a wider community. And most importantly, we assess it against the guidelines that are presented, because every conference has abstract guidelines. For example, word count, spacing, font sizes, font types, and the various subheadings that are required for some abstract. Next slide. Next slide, please. So these two slides will talk about some samples of abstract. The abstract we see on the screen here is what we look at, or we call a good abstract, because it's well structured. It has a title, it has the authors, there's a background information which is very concise, the objectives or the goal of the study, the methods have been stated clearly, the results, the key findings have been presented, there's a conclusion, and even an implication for practice. So it is clear and informative in terms of the title. The presentation is logical. It has very comprehensive information, even though short, and data and statistical analysis have been presented well. The next abstract. Next slide, please. This is considered a poorly structured abstract in terms of assessment, because even the title alone is not, it doesn't communicate enough. A study on antimicrobial stewardship in Ghanaian hospitals, because it's not everything about antimicrobial stewardship that was studied. If you look at the background, it's a mix of very vague information. The objectives, methods, and results have been put together in one paragraph. You go to the next paragraph, there's still objective, methods, and results of findings. Then the conclusion and recommendation are not precise enough. So in terms of assessment, this abstract may be shut down and will not be allowed to pass through in terms of allowing acceptance. Next slide. Okay, so what should you do when you are presenting an abstract? First, keep it to clarity. Make sure your content is clear, concise, and coherent. You use formal and professional scientific language. Avoid jargons, and also check for errors. Again, specifications. You must specify or stay within the specified word limit. In terms of formatting your text, you must try and follow what is required by the organizing committee or the conference organizers. Next slide. What are some of the common mistakes that get our abstracts rejected? Sometimes they are vague or incomplete in terms of the information you provide. Sometimes you have so complex terminologies or technical terms, too much detail, and the readers may end up not understanding what you are trying to communicate. If you do not state your objectives clear and your conclusion based on the objectives you set out to do, then the abstract may not go through because assessors will look out for this. Again, poor grammar and formatting issues, and especially for grammar, if the language you are writing your abstract in is not your first language and you do not have the command of it, then it's advisable to seek help from people, at least a second person to look through, to be able to be sure that there are no grammatical errors or formatting errors. And also try to avoid uncommon abbreviations. Sometimes people use abbreviations thinking everybody should know this, but very often this is not the case. And so these are things that can get our abstract not going through. Next slide. Next slide, please.
I've changed it. Can you say it? Hello? Hello, Dr. Jato, are you still there? Yes. Meanwhile, while we give him a few minutes to get back, can you hear me, please?
Yes, we can, Arinola.
Okay. I'd just like to apologize because I noticed that most of the slides, the headings are gone. I don't know how it happened. Those slides came with headings, but somehow something has happened to them. So please accept my apologies on that. That is not how Dr. Jato sent the slides to me.
Yes, thank you very much. And I'm sorry we have network issues in Ghana, so this is one of them. So my point was that we should, in preparing abstract, you must look for some specifications so that you meet this, and the assessors will look out for your ability to comply. Again, if you take the FIP abstract submission process, for instance, we have several sections and special interest groups in FIP. And as you will see in the panelists, we are made of people from different groups within FIP. So you must be sure your abstract is submitted to the right section. So you look at the type of abstract. Is it a research? Is it a practice-based work or an educational initiative you want to communicate to the scientific community? You must make sure you match your abstract to the right category. Some abstracts end up being rejected not because they have low quality, but because they do not align to the objectives of the section. And so before you submit your abstract, you go through the FIP abstract submitting portal and be sure of which interest group or section or area of practice is the best fit for your research. Next slide, please. So if you go to the FIP platform, for example, today, this year's conference is in Copenhagen. We have the abstract submitting platform. They have the timelines. They have the requirements for each abstract. They even indicate the peer review process and the selection criteria. If you do not make time to understand this, then you prepare an abstract, which may be a standard abstract, but does not follow the requirements of the organizers or the conference team. And this can end up causing the abstract be rejected. And so, again, we must make sure
Okay, hello everyone. Arinola, are you here? Can you hear me?
Yes, I can hear you.
Okay, perfect. Do you think I can, from the information that we received from Jonathan so far, I can show how we can do this on the FIP portal, maybe?
Yes,
While
please
we
go ahead.
wait for Jonathan to come back.
Yes, please go ahead.
Okay, so just like Jonathan, by the way, sorry, my name is Ali. I am the Congress coordinator of FIP. I've been working, which LinkedIn reminded me, I've been working for FIP for more than 5 years now, which is a big milestone for me. And I have the honor of serving you colleagues as a pharmacist as well, serving you for 5 years. So what I can do is I can, with the information that we received so far from Mr. Jonathan, I am going to try to share my screen with specifically submitting abstracts for the FIP Congress. Hello, Jonathan.
Thank you very much. As I indicated, we have some network issues.
That's totally fine.
Yeah.
Would you mind if I, for example, jump in and show how?
Sure. In fact, I was almost
okay?
ending with a presentation, so you can come in, please.
That's all good. So this is the main page of our Copenhagen Congress. So once you enter here, there are a lot of really important and nicely prepared web pages, of course, thanks to the FIP team. But what we are going to focus on is, just like Jonathan said a couple of minutes ago, we will go to the abstract. And to know how to write the abstracts on guidelines on writing and submitting an abstract, you need to click here. And once you do, you will have quite a bit of details here on how to do this. I am not going to put too much information here so that we can save some time. I will go to the abstracts, call for abstracts button. Once you do that, you have to click here to submit your abstracts. Once you click there, you will be directed to the abstract submission page. I already logged in here, so this is not going to look like this when you enter first. What you're going to have is the home page and the contact information page. And these two will appear after you update your contact details by clicking Edit Contact Details here. Let's assume that you did all of this. then you will have these options enabled, which is abstract submission and view edit abstracts. I will go to the abstract submission. So at this point, we have title and presentation type as our first tab. In here, just like Jonathan said in his presentation, the abbreviations should definitely be avoided, especially in the title. We sometimes think that everybody should know about that type of abbreviation, but that is not true. Some terms are new for some of us, even though it's not for the others. So what I'm going to do is, this is a test submission for the APF webinar. And from here, I will choose my presentation type to be either oral presentation or poster presentation. If you don't have any preferences, so you don't mind to give an oral presentation or a poster presentation during the Congress, you can say no preference. But if you would like to give an oral presentation, a rapid fire oral presentation during the Congress, you choose the oral presentation. Or if you prefer to be standing in front of your poster, showcasing your work, you will choose a poster presentation from here. And again, that was one of the topics that Jonathan was going to talk about, which is you need to choose the topic depending on the sections and special interest groups that FIP has, which are academic pharmacy, clinical biology, community pharmacy, health and medicines information, hospital pharmacy, industrial pharmacy, military and emergency pharmacy, social and administrative pharmacy. And also for the special interest groups, we have drug delivery and manufacturing, new generation of pharmaceutical sciences, new medicines, personalized and precision medicine, pharmacy practice research, pharmacy technicians, and regulatory sciences. So for the sake of this, and to say a hi from here to Charlotte, I will choose pharmacy practice research. And then we come to the author section, which is actually quite important because this is one of the areas that we receive the most errors from, because sometimes when you go below on the screen, you may forget to add your biography. And then you will have the submitting author's information here. This is the author, abstract authors, and this is the affiliations. For example, I am from FIP, and I also want another submitter to join me. I am just going to type down the information of my wife. She's not going to be the presenter. Let's National Federation. And since she's from the same affiliation from me, which is number 1, I will write affiliation number 1 here. If I want to add another affiliation, I can do it with this button, and then that's going to be number 2. And if I have another author with that affiliation, I need to enter affiliation numbers 2 in there. So let's say we are done here, and the content should be short, course, and not too long as well. Please remember the things Jonathan told us, because they are more detailed than the information you will find here. So once this webinar is over, you can always go back to YouTube and listen to it again. There are some really key information in getting your abstract submitted and also accepted. Now I move here. If you are under 35 years old and you are submitting to one of the special interest groups, which are written right here, then you can actually apply for the Young Scientist Award. You can get more information from here. And for the development goals, if your work is under the umbrella of one of our development goals, please feel free to choose them and then click continue. As you can see, of course, this looks quite short because I made it a very short one, but as you can see everything written right here. So if you see any problems, you can go to the tabs, check them again, and correct the mistakes there. The deadline for abstract submission is the 17th of March, 2025. Until then, feel free to do any changes, any edits, and then once you click continue, You will agree on the term and conditions. And hopefully, if my internet also wouldn't play games on me like it does on Jonathan. Okay, it worked fine. So as you can see here in view edit abstracts, you can see the test submission that I did. If you want to do more, you go back to abstract submission. And from here, if you click back on the view and edit abstracts, you will see your draft has been working on here. So you can click on edit and then work on that draft as well. So I think from my side, this should be all. And for the rest, I think I'm going to be on the panel, Arinola. So I'll be here. If you have any questions, I will check the Q&A box and also the chat box. So if I see any questions there, I'll reply to them. But thank you so much.
Yeah.
And thank you, Jonathan, and sorry for stepping in.
Oh, no, thank you for filling in. It was a very necessary use of time. So thank you. So we continue with the presentation. And have Jonathan continue from where he stopped.
Yes, so whilst Arinola is trying to share the screen, let me just make this comment. These internet issues are one of the reasons why those of us who have come from places without stable internet, you don't wait to the last minute. So in terms of preparing and submitting your abstract, do not give yourself the last 1 hour. It can make you miss the deadline. So what you do is you start ahead of time and plan. Importantly, when you prepare the abstract, have a second person to take a look at it. This is very good. For those of us who research in groups, it is easier when one drafts the abstract, sends around for comment. But if you are working alone, even if you are a single author that you want to submit, make sure somebody else has a look at the abstract, make comments before you submit. And so planning is very key, making sure you stay within time. If you want to try a last minute submission, maybe it ends at 10 p.m. tonight and you want to start at 9 p.m., some of these internet challenges can take over and you end up missing the deadline. I think I was just at the tail end. A few things I wanted to add is that we should ensure that our abstract align to at least one of the priority areas, which is the FIP development goals or the theme for the conference. We should also be sure that we have some novelty that we are reporting to the scientific community, be it a research, be it practice, innovation, or even a policy, educational policy that I want to drive across. Please try to also read through your document. It's become a problem when some people submit abstract without reading through. You end up seeing that this work was rushed to the table for submission. And so this is very important. Again, writing, to me, especially those who are students and we are all learning, is it's an art. So you must make sure you write, you practice, you learn how to do it, and you become perfect. So you read papers that have published a lot of abstract, always read the abstract, look at how they constructed them. Some of them may not be the best, but they are all learning process, and you practice. Look at journals, take them, and also get help from mentors and colleagues. You always share what you don't know, you learn from others. You can also attend classes like we are doing today. It's a webinar, but you learn something from it. So abstract writing and scientific writing generally is an art, and one must learn to build. The takeaway from my presentation today is that we should plan early, align our abstract or our presentation to the themes of the conference. We must make sure it fits in. We should also follow what guidelines or requirements are given from the organizing committee of the conference we are planning to attend. We should try and meet deadlines. When you prepare an abstract and you are not able to submit it to meet deadline, then you are sure that that abstract will be rejected. The last is that you seek an opinion from colleagues, especially in the research community, so that they pass their comments on what you have done. And that can help you to correct your mistakes before you submit it to the larger community. As an assessor of the academic pharmacy session, we always look at 4 C's of abstract. Is the abstract complete? Is it concise enough? Is it clear? And is it cohesive? Cohesive in the sense that there must be a flow of thought. The two abstracts I presented, especially the one that was recognized as a poly-structured abstract, you will be reading, find an objective, you get into the middle, and you are seeing a second objective. You see results in the first paragraph, you move to the next paragraph, you see results again. It makes the flow of thought not nice. So you try and ensure that it is complete, it's concise, it's clear, and cohesive. And I want to thank you. We'll break into the discussion session and we'll be able to further answer any questions that are available. Thank you very much for your attention.
Thank you so much. Thank you so much, Jonathan, for your presentation. And thank you also, Ali, for coming in at the time that you came in to provide some much needed detail. So we're moving on to the panelist section now, and we've already met Ali. I don't know. I'm not sure if he has any additional comments to share right now. So I'll just move on to the next. There's so much confusion today. So let me just introduce Ali, although we've already met him. Obtained his BPharm degree from the Near East University. He currently serves as Congress coordinator. So we'll be seeing a lot of him, those of us that plan to be in Copenhagen, and is the FIP officer responsible for managing abstracts for the coming Congress. Our next panelist is Mujahid Valji. He is a clinical pharmacist by profession, having completed his bachelor's in pharmacy at the Muhimbili University of Health and Allied Sciences in Dar es Salaam, and graduated also from the Queen's University Belfast with an MSc in clinical pharmacy. He has been working as chief pharmacist in Aga Khan Hospital for 14 years and has been a part of the FIP Hospital Pharmacy section, serving as its vice president, Africa region, for the past 6 years. He's also a member of the PST Education Research and Publication Committee. So please join me in welcoming Pharmacist Mujahid to the session. And I'm going to be asking him in his role in the hospital pharmacist section. Mujahid, are you there?
Yes, I'm there.
All right, then. Thank you so much for being here. Thank you very much for participating in this webinar. So in your role as within the hospital pharmacist section, could you give us some information as to expectations of the hospital pharmacist section of abstracts that are submitted to it? Thank you.
Thank you, Arinola, and thank you for inviting me to be part of the panelist. So I think the general criteria have already been as an earlier speaker, Jonathan, he has clearly stated what are the general requirements of an abstract. But now, if I come down mainly to hospital pharmacy section, I would like to, in addition to what Jonathan said, I would like to add the relevance of the topics to the hospital pharmacy. So try to if you want to send an abstract for which is related to hospital pharmacy, take topics which are very relevant to us. So for example, topics like medication safety, clinical pharmacy services, antibiotic stewardship and other stewardships, right? We have narcotic stewardships and others, oncology, non-communicable disease, okay? In pharmacovigilance, which involves medication error, patient safety, ADRs, supply chain management, okay, and patient care improvement and the likes. So see your topic aligns with what a hospital pharmacist section, hospital pharmacist would do, number one. Number two, it is, for those who are familiar with the FIP hospital pharmacy section, we have statements, basal statements, right, which are standards for a hospital pharmacy. We have set some standards for a best hospital pharmacy practice, It is an assessment tool. It is free of cost. There are no charges. They are all online. So any hospital can decide to do the self-assessment. They are scored, and then they can have the intervention, and this tool will even give them some priority areas. Thereafter, they can give themselves some time, let's say 3-6 months, and then do assessment again to see have they reached, have they improved after taking the assessment and doing the intervention. So my point, so this was just introduction to basal statement, but my point was try to see how are these abstracts relating to basal statement. Which statement are there? Obviously, it can't be the whole basal statement. It has sections: procurement, prescribing, dispensing, monitoring, HR. So which aspect of basal statement are you aligning or linking your abstract to? That would be a big plus for you when you are submitting an abstract to hospital pharmacy section.
Thank you. Thank you very much, Mujahid, for those initial thoughts. I'll circle back to you in the next set of questions. So let me go to Rendani. Rendani Tshilambwana. I hope I didn't mother the name too much. Is a pharmacist who holds a B.Pharm degree as well as a Master of Pharmacy, specializing in public health pharmacy and management. She recently completed her GCP, that's Good Clinical Practice certification with CRED. She has served in multiple pharmaceutical associations such as Tutu Labs, SMAPS, and SAPS, which are local and national associations under the FIP umbrella in South Africa. She's also an FIP HAMIS, that's the Health and Management Information Service section, poster presentation award-winning pharmacist. And that's why she's here with us today to share some of her preparations and disposition in putting that poster together, that abstract together that eventually won the AMIS Poster Presentation Award. She has working experience in community pharmacy, academia, and correctional services. However, she currently works as a quality assurance pharmacist at a medical aid as health insurance administration company, which represents one of the biggest medical aid schemes in South Africa. So Rendani, you're welcome. Could you put on your screen, please?
Thank you, Arinola. Good morning, good afternoon, good evening, based on wherever you are in the world. Can you hear me and can you see me? May you please confirm?
Yes, very clearly.
Okay, thank you so much, Arinola. And thank you to everyone for joining this session. So as Arinola has already mentioned, I'm here because I also submitted an abstract a few years ago in 2022 for the FIP World Congress in Seville, Spain, and it was under the HAMIS section, and I chose to present via a poster. And the poster eventually won the best poster at the Congress. So just maybe a background of what my poster was about and how it led me to choosing the HAMIS section is because, so my research was about checking the adherence, the refill adherence of members or patients that were on, there's a program in South Africa that we call the CCMDD. So basically with this program, patients of the public sector collect medication from sectors like private sector. So the government works in conjunction with the private sector in order to reduce the queues in the public sector. So now patients go to private pharmacies, certain adherence clubs, and so on to collect their medication, and that's the program that we have. So now there was obviously COVID came, and it shifted a lot of things, and it changed a lot of things, and there was a lot of people were scared to go out and to get their medication. So that's where the research that's how the research came about. And so it was to investigate the adherence to the collection of their medication from these institutions prior to COVID, and also comparing it to during COVID, so that we can see whether there was an impact on that particular program in our country, and also how severe that impact might have been. So I was doing my master's. This was my master's research, actually. So I submitted the abstract, and I think it as the Dr. Jato has already touched on all the tips of the abstract. I think everything that he mentioned is exactly how he mentioned it. That's how I went about it. With your title, you make sure that it's short and precise and straight to the point. So what I just mentioned now, giving a little bit of a background, is how I would have put it in the background and introduction space, just to make the next person to give an overview of how things are in the country, what the project is about, or the research is about, and how it's going to impact, and then also putting methods in the abstract and making sure that method is clear but still short. If you look at a research paper, most of the time the method can be a couple of pages, but unfortunately with an abstract you can't have a couple of pages. You have to make it short but still meaningful, so the next person should be able to read your abstract and see and know exactly what it is you did to conduct that research. So those are things that I did, and I shortened the methods that I used, and then put in the provincial results. So my results at that point when I submitted were actually not final. I had not completed the research, so I submitted what I had achieved so far at that point in time, and I did mention it in the abstract as well, because I think some people fear not submitting because they say we are not done with our research. But it's okay, even if you are not done at that point in time. You have a title, you have a method, you have received something. If you have something, then you need to be able to put it on paper. Even if the abstract is slightly different to the poster presentation at the Congress, because there is quite a couple of months in between. The presentation, the poster abstract, or all abstracts are due, I think, next month, right? And the Congress is only happening in August. So a lot can happen. And I think in the research space, things do change. You might receive additional data, or you might have to reduce and exclude certain things based on how your research is going. So that mustn't be a limiting factor. If the research that you are conducting is not complete, you can still put what you have. So that's what I did. I put what I had at the time, those provincial results. And so after submitting the abstract, that was accepted, and then they contacted me, the Hamis department section. They contacted me to say that I've been shortlisted for the poster. To be honest, I didn't know that there was a competition for poster presentations, so I had no idea. But I think they saw my abstract, and then they reached out via email. So check your emails. Always check your emails and make sure that you're up to date, so you can see when you receive certain communication. So I received that email, and I read it, and I saw that they've now selected my abstract, or it's shortlisted, and I have to submit a full poster to them. So it's not just the one that I'm going to take to the conference, but I had to submit a digital poster. They gave me the platform to submit it on, and I prepared that poster. I had so many sleepless nights because I believe that it's, like I said, I didn't know there was a competition, but for it to be selected without me even knowing meant that there was something there. And it means that the information in that abstract was good enough for them to say, we would like to see a poster, and I submitted the poster. So the platforms that I used are PowerPoint and Canva to prepare my poster. Canva is very creative, not very user-friendly. If you are planning on making your poster using Canva, it's not very user-friendly, but there are multiple tutorials on YouTube. I always call it YouTube University of YouTube. You can graduate for some of the best softwares from YouTube, from the University of YouTube, because there are just so many informative videos and tutorials that you can follow, and then you can also add your own originality and creativity and obviously your own information. So Canva is great, and also PowerPoint is great. And I think another tip is it's already been mentioned, relating the abstract to one of the sections and adding that in the abstract itself, and even in the poster. And I think another thing to follow if there's a competition is to look at the assessment criteria. So they will send you an assessment criteria, and they'll say these are the 10 things that we'll be looking at. Make sure that when when you're making your poster, you go according to that. So at the end, I think one of the things that were on the criteria that I had not added on the abstract was the significance of the study. So on the poster, I ended up adding that significance in a short 2-3 lines, just to say that this is how the research impacted, or this is the impact that it will have in the future. So yeah, relating it to the section, and also making it short, concise. I think my colleagues have already touched on in depth regarding all of that and how to go about it. But I think the one thing that I've seen in most people is the fear of submitting with incomplete research, and I think that is a limiting factor. Do not allow it to be your limiting factor. You should submit what you have at that point in time. Just maybe state that these are the provisional results, and then at the conference, you will be submitting the final results. And that will also give you motivation to complete that research, so that when you go to Copenhagen, you have the complete research and you're able to submit it and present it properly. So yeah, if there are any questions, I'll still be here. But I think I tried to just summarize and give input as much as possible. Yeah.
Thank you so much, Rendani. Thanks for all those tips. Some of those tips that are things that seriously, people really limit themselves without.
Yes.
Let me know. This work is not done anyway. By March, it will not be done. So
yes.
Very, very good information that you have given. Thank you so much. So I'm going to pivot back to Jonathan and ask a question. Jonathan, is it only academic pharmacists, and each of you also may add a statement after Jonathan has spoken? Is it only academic pharmacists that are expected to submit abstracts to the academic pharmacist section? Is it only from those that are in academia doing research that can submit abstracts to the academic pharmacy section? Jonathan, over to you.
Thank you. So the answer will be no. In terms of the research, you could be in academia, but the research you conducted is maybe on a regulatory medicine regulation, or even military medicine, or a different section. So the most important thing is the kind of work conducted, not the section itself. So if the research falls into the area of academic, or the team of the academic pharmacy section, then you can present your work there. Last year, I was in Cape Town, South Africa. I'm a member of the academic pharmacy section, but my abstract was on pharmacy practice research. And so I have to present in that section. So it depends on the research you are presenting, more importantly, than the section you belong to. What is also important is that, as my colleague has said, Rendani has said, you must ensure that your work goes out there. So even when it's ready and you're not sure which section, sometimes it's good to submit than not to submit at all. You can also have the opportunity to ask questions. The FIP has support staff who are available to guide you. So when you have issues and you plan ahead, you can send an email. This is the topic area. This is the area I want to present on, but I'm not sure which section this fits into. And there are people on ground to guide you to. So the research is the most important. And when the topic falls into industrial pharmacy, but you are in academia, you can present it under industrial pharmacy. If it falls into new medicine areas, you can present it under this section. So that's the answer I think I would give for this.
Thank you very much.
Thank you.
Valji, I'm coming back to you and asking the same, starting with the same question, that does the hospital pharmacist section only accept abstracts from those in hospital? And then you talked about the basal statements, and I know that that is something that the hospital pharmacist section has been trying to get as many hospital pharmacies across the continent to key into it as much as possible. So you may also, in addition to answering that first question, also give the links where they can get this access to the links to the basal statements and how they can go about it. Thank you.
Thank you. Thank you. Okay, so coming to the first question, no, again, so it's any it can be by any it's not necessarily from a hospital, but anything that relates to the hospital pharmacy activities, right? And hospital pharmacy, member, is very broad. It starts from procurement, the supply chain is involved, availability of drugs, prescribing, information technology, right? With the AI revolution, it's the whole. I mean, everything is changing. The way we are dispensing drugs, the way we are processing information. So the same answer, that it could be anything, but it should be relating to the hospital pharmacy activities. Number one. Number two, if that research or abstract is going to bring about patient care improvement, right? So today we have any information about, let's say, about medicine reconciliation, right? That's even a big topic between transition of care. A patient is in the hospital, now he's going to a home, to their homes, right, on discharge, or going to another clinic. So if, let's say, if there's an AI or information technology abstract which can ease the flow of information, all such abstracts would be welcomed, and we accept that. So we also have a format whereby we score according to the abstract structure, the objectives, the methodology, the methods used, the results, discussion, the written English expression, and the overall quality of the abstract. So those are the criteria that we use for assessing the abstracts. And just to add to my earlier answer is, so you can, it's good to link your. I will share the information on battle statements. I'll share the link in the chat, and I will. So we even have a committee whereby we have representatives from South Africa, Kenya, Ghana, Nigeria. So you can even liaise either with them or with myself if you want any assistance in carrying out the assessment, or to know more about it. We are available. So I'll share my number and the link. And just to add, in our expectation is, when you are doing the abstract, when you're presenting the abstract, please use generic names and not branded names. Okay, wherever possible, because we don't want to do any promotion. This is not a promotion activity, not a marketing activity. It's solely an academic activity, and it's good to use science, evidence-based approach, right? And innovative. So it should be something that is new, is going to bring about a change. And lastly, it should be something that is relevant. And when you say relevant, so for example, AI, right? So AI is so fancy. I mean, everyone is talking about AI. But if I did my research, if, let's say, my practice is in a rural area, okay, in Africa, I don't think AI is as much of my priority as basic clinical pharmacy services. Let's into our perspective. Let's see what is really relevant, which will impact a practical implication, which the results can be used to improve our services at our level where we are. So let's look into that perspective, so that we give something that is more authentic and more impactful in our setting.
For our communities. Thank you very much for that. Before I ask the next question, our president, the president of the African Pharmaceutical Forum, is on the call. So I would like her to unmute herself, and I hope she can do that. FIP Congress Office. I'd like her to unmute herself and speak to us, welcome us all. Pharmacist Jocelyn Chiva is on the call. So please, would like you to address the attendees on this call. There you are. Over to you, ma'am.
Good afternoon, good evening, good morning. Can you hear me?
Yes, we can.
Yes, thank you so much. It's my pleasure to be on this call as we look forward to going to Copenhagen in 2025, September of this year. In fact, we always find that we need presentations and participants from the African region to be part of the international forum and be part of the World Pharmacist family. And this is one of the reasons why I want to appreciate Dr. It's now Professor, isn't it? Professor Joda for organizing this webinar, so that when we get to Copenhagen, we have people who have done the right thing. We have an opportunity to have more pharmacists from the AFRO region participating. We've been always finding ourselves wanting. There will be very few of us who will be presenting. Thank you so much for organizing this. And then I also want to appreciate the presenters also, including the ones from hospital pharmacy, for example. There's been a call for people to participate in the hospital pharmacy project, following up on the Basel statements. And for those who have attended the FIP, the issue of hospital pharmacy since the Basel statement, that was in 2008. So a lot of things have been changing over the years, and we don't want to find ourselves lagging behind as pharmacy is moving forward. Thank you very much, everyone, for attending. Your presence is greatly appreciated. Without you, our efforts will not be worth it. But because of all your presence, Dr. Arinola's team and the FIP's efforts are worthwhile. Thank you so much.
Thank you very much. Thank you very much, President. Thank you for being here. And other EXCO members that are on the call, thank you very much for being here. I pivot back to Jonathan. You mentioned the 4 C's in your presentation in assessing abstracts from the academic pharmacy section. What are some of these things that are in particular that abstract submitters should look out for? I know that for some of us in academia, writing abstracts and writing articles is like almost second nature. But for many of our colleagues that are in especially direct patient-facing practices, hospital, community, clinical pharmacy, many of them struggle with how to tailor their abstracts and what to do, and so they give up before they have even started, So I know you have mentioned a few things, but just to bring them out some more to make it clear on what assessors for the academic pharmacy section would be looking out for. Sorry, before you talk, let me apologize that we did try to get some additional panelists from the community pharmacy section and as I mentioned, the PPR, but unfortunately we were not able to, so a lot of, and Dr. Jonathan, if you can also pivot to some of the things those in community pharmacy, because community pharmacy section is one of the largest sections of FIP, so if you can also address what those in community pharmacy should look out for when they are submitting their abstracts, and then ultimately when they are preparing posters, if their abstracts are selected. Thank you very much.
Thank you very much. So let me start with the 4 C's. The 4 C's talk about the content of the abstract. So, for example, is the abstract complete? It will be complete in the sense of having a title, having the names of the authors, having the background, having an objective of the research, methods, results, which are a presentation of the key findings. You have a conclusion, and sometimes some instances, the organizers may ask you to add keywords and also references. And for those of us in academia, because we do this very often, it is easier for us to do it. And that's why I talked about planning. Those of us in other areas where we are not, most of our work is not research, or we gather data every day, but we are not used to presenting abstract, we're not used to making presentations, it could be a challenge and we get discouraged. But our goal is that, well, let's work together. For example, I'm in academia, somebody who is in community pharmacy, you have conducted some research, you have gathered some data, you have enough information, but you do not know how to convert this into a presentable abstract. You can reach out to somebody in academia. That's the first step. If you do not have somebody to help you in that regard, there are also opportunities for you to self-learn. So you can draft a document, send it to somebody to also have a look at it. Now we have a lot of systems to even help. You can go online and look at how do I prepare abstract. It's just about commitment. Okay, the most important thing is your commitment, because if you know you have done a good job and you want to learn how to prepare abstract or poster presentations, you need time. Those of us who are very good and conversant with the processes, we may do it at the last minute, maybe some 1 hour to the deadline, and we are rushing to submit this. But if you are not used to this, then you should start ahead of time. Again, we have some supporting materials. For example, you go onto the FIP website, you can see abstracts that were presented in the previous conferences. So you can look at this old abstract, and that will serve as a guide for you to know how to present yours. The next thing I will want to encourage our colleagues from hospital pharmacy and from community pharmacies, every single day we generate data. But most of the time we leave this on our shelves or in our systems and we do not use it for anything. Let's start converting this data into a form that can be communicated to the scientific community. Every day patients walk into your community pharmacy with chronic conditions. You can try to look at the trend or prevalence of this chronic condition among your patients, your clients who are coming in. It becomes a steady area. So it doesn't have to be a research where you set out to do it and then you start, for example, looking for funds to go to the field to conduct data. The data you gather every day in your workplace, that operational research can be presented. When we come to what we, in terms of assessors and evaluators of abstract and posters are looking for, let's start with the abstract. We'll look at what is the message you are carrying across. So first of all is to look at the scientific merit of your paper. Whatever you are presenting, is it scientifically meritorious? Is it fitting for purpose? What is the relevance of these to the practice area where you are submitting this? Is there a novelty? Is it very important? Originality. You do not present, maybe you have presented an abstract somewhere and you are resubmitting it over and over to different places. It's the same work. So it must be original, it must be novel, so that people get to know something new from what you are presenting. If you already published the paper and it's in the domain, it's usually not recommended that you go again, take the abstract of this paper and resubmit. But if it's some work, as Rendani said, if it's some work you have done, it's not even complete, you can submit an abstract on it because you have some results to present. Then questions will arise from that result. We also look at the organization and the impact of your recommendations. Organization in terms of the structure, how you arrange the sections, and how you recommend the work to be done or what is outstanding, so that somebody can get some topic from your side. If it's a poster, usually poster, the same thing. We look for this organizational structure, formatting, language, but we also look out for appeal. Your poster should be beautiful. Sometimes people do not read the instructions. The poster is supposed to be portrait. They go with a landscape poster, and you paste it on the board, which is designed for portrait poster, and you have yours hanging outside. So it should be neatly designed, and it should fit into the specifications of the organizers. The content, again, the quality of work, and if you have nice images to use, you make sure your printing is excellent. If your printing is blurred, people are not able to see figures, people are not able to see details of your images, then it will affect the scores that you get for the assessment. And let me just add to what Rendani said. When we have assessors coming around to look at your work, most of the time, they do not reveal to you that they are assessors. They come as regular conference attendees who are interested in looking at what you have done. But in the process, they have checklists they use to evaluate this. So no matter which section you belong to or where you are presenting, if your work meets this criteria of being complete, concise, coherent, and maybe you're able to convey a message to somebody readily, not too complex, then I'm sure you'll get a good assessment from the assessors or evaluators. Thank you.
Thank you very much, Jonathan. Let's now pivot to the audience. There are some questions that have been dropped on both the Q&A and the chat box. Somebody is saying, is the webinar in the PPB portal? I'm not sure what that means. So if somebody knows what that means, please do clarify. How shall we claim our CPD as the webinar is not yet uploaded in Pharmacy and Poison Board? Okay, Pharmacy and Poison Board. Well, I believe this may be for FIP to answer, but I'm not sure we said anything about CPD for this particular webinar, but we can find that out later. Who is eligible to submit and present an abstract in a pharmaceutical conference? I believe it is anybody that is doing anything that is pharmaceutical in origin can submit an abstract. You don't have to, for most conferences, you don't have to be a pharmacist. For instance, for FIP, you don't have to be a pharmacist to submit an abstract. You could even be a lawyer that is doing something in the pharmaceutical space and you have something to share. And for FIP, we also have the pharmacy technicians that are also part of FIP, and they also have their own slots for presentations, you know. So as our panelists have said severally, it is the content of the work that you want to submit that will determine whether there's an eligibility for you or not. Is reading the abstract an important step in writing the abstract? It's very important. I think I can answer some of these questions myself, being an academic pharmacist myself. You know, as Jonathan mentioned, when you put your abstracts together, even if English is your first language, for many of us that are researchers, whether you're an academic researcher or even somebody in practice that has been doing research for a while, sometimes we love our writing, we love what we have put together. So when we put that thing together, our first thought is that this is perfect. Oh, see my brainchild, I have done good work. You know, by the time you read through, some people will suggest that you read through once, twice, you keep it for a few days and then read through again. You would see some things that are not coherent. You will see some things that could be put better, that could be edited. And so reading your abstract, reading any piece of writing that you do is a very good step in ensuring the quality of that writing. Rendani, there's a question for you that I'm going to read out to you, so you please be ready to answer it. What are the biggest challenges you have faced as a quality assurance pharmacist? Ooh, I'm not sure how that fits into our work, but maybe we can give you 2 minutes to answer that question, Rendani. What are the biggest challenges you have faced as a quality assurance pharmacist?
I think the biggest challenge has to be accountability. So as a quality assurance pharmacist, it almost looks like you are there to police and make sure that everything is up to standard. It's according to the standard operating procedures or SOPs. So ensuring that the relevant people take accountability for whatever they have done or they need to do can be a challenge sometimes, because, you know, sometimes people just want to not maybe sweep things under the rug, but to make excuses for certain things without finding solutions, right? So they will just provide problem after problem and not giving solutions to say, okay, these are some of the challenges that we faced, but this maybe we didn't meet the quality because of this and that. I mean, every place has its own challenges. So in places where you don't get that, when someone wants to like shift the blame and not take accountability for certain things and not operating according to the standard procedures, therefore reducing the quality of the work that is produced, the quality of the service that is given to them to the patients, then it becomes a big challenge, because if you are not accounting, then we cannot move forward. We cannot correct whatever it is that needs to be done and move forward. So I think that's one of the biggest challenges. In short.
Thank you. Thank you very much, Rendani, and thanks for that question. There are several people dropping their emails in the chat box. The email that you use to register is where the certificate will go. So there's really no need to drop your emails here. So the emails that you registered with is where the certificates will go. So the advice is just to ensure that in case you don't see it in your inbox, you check your spam. The email where after you registered, you got a message saying that thank you for registering, and if you have a question, you can drop it in the chat box. That is where your email will go, your certificate will go. Nobody's going to be harvesting emails here. So if the email you registered is not your regular email, please check it and pick your certificate from there. I saw a couple of questions in the chat box that I was although I think this has been answered, that what kind of topics are preferred via oral? Okay, no, it hasn't been answered. So over to you, Mujahid. There's a question that says that what kind of topics are preferred as oral presentations for hospital pharmacy? And I think maybe Jonathan would also answer that so is there a preference for what is accepted as oral versus poster? And maybe Ali too will also add a thought to that. Mujahid, over to you.
Yes, so I think, as per my understanding, be it oral or poster, the topics, I mean, it's just the way you are presenting, right? The topics I had mentioned earlier, but just to repeat, is it has to be impactful. As I said earlier, let's not just do a research for the sake of it. No, let's do how is it going to help my hospital, my community, my country. See what impact is it going to have, right? So, and how is it? And usually, a problem in your, or a challenge in your hospital or in your area could be a very good idea for a question which you could work on and then present and then do the research. Because if it's a problem, that means someone needs to come with a solution. And what better way than using a research? Do a research, come with a solution, present it, and hopefully it has a positive impact. So it's not only going to change your systems, but even someone else in a similar capacity can use it to bring about patient care improvements. So as I mentioned, topics like pharmacovigilance, how to reduce medication errors, adverse drug reactions, supply chain availability of drugs, how to ensure we have, because in Africa, that's a big challenge for us, right? Supply chain, unavailability of drugs. We know what we went through for the vaccines. So all these things are non-communicable disease. And a very good point that Jonathan brought, which I forgot to mention, is we have a lot of data. Especially hospitals have a lot of data, because we don't only have data of dispensing, we also have data of prescribing. We are an interdisciplinary. So we have data lying. It is just to find time, to find the right question, not just any question, a meaningful question, and then convert it into, and then just make the methodology, what you are trying to achieve, and carry out the research. And antibiotic stewardship is another big thing, right? We know the impact that the resistance is going to have. So that's another, and there are a lot of funds that are even available on antibiotic stewardship. Like some of these, oncology, cancer is coming up in Africa as well, right? So we know the diagnosis comes very late. It's a very upcoming. So antibiotic resistance, oncology, those areas which have developed, right? Or those setups which are, AI is another thing. We know how robotic dispensing and although it's quite rare, but other aspects of AI which we can look into. How can that save cost? Cost containment could be another thing. Universal health coverage. we pharmacists play a very big role, right? So these are some, but as I said, see how you can link it to Basel's statement and even the FIP development goals.
Thank you. Jonathan, you have one or two things to share. We have about 10 minutes to go in this webinar. So.
Yes, so similar to what James has said, for the academic pharmacy section is the same thing. We do not expect that we right away predict that bring this for oral, bring this topic for poster. Sometimes it depends on the quantity of data you have in your abstract. For example, Rendani said, if you start with 4 objectives for your research, but if you achieve 2, and that is presentable as an abstract. If you want to make this as oral and the data is not much, you feel like, okay, I will not be able to present a lot on this, so let me make it into a poster presentation. Somebody who has done research on 4 objectives and has a lot of data may want to present it as oral. So the platform has the option for you to choose oral or poster presentation, but the assessors and the reviewers will be the last to determine whether the abstract is submitted qualify for oral or poster. One key thing is availability of space. The organizers look at the timelines available, how many people can be given slot for oral presentation. So if there are 20 abstracts that can all go for oral, but the time available is only for 5, then we'll select the top 5 and allow the other candidates or participants to submit their abstract or to present their abstract as posters. So one key thing is you look at the quantum of data you have and also whether there will be a slot available for you. Now, the last part I want to add to the students, somebody asked whether if you are doing research, you must, if you don't have all the results, whether you have to wait or you can submit. And it was answered by Ali. You can present some of your results, or if you don't have any results, you present your method and state where you have gotten to. If the organizers feel like the time the conference will kickstart, you would have gotten results to present your work, they may allow you. In some instances, this is allowed. So if you don't have results and you are sure that you can get the results within a good timeline, you can make a case for it, just that you have to indicate so that it doesn't look like it's an incomplete abstract, but they will be aware of you. I think this is what I want to add. Thank you.
Okay. Ali, you have one or two things to add?
First of all, I would like to thank you, Arinola, also Jocelyn, and also all of the great speakers and panelists here. I think this is actually some great work that we're doing here. Topics are definitely important, and Mujahid covered the ones for the hospital pharmacy, and Jonathan added some for the academic pharmacy as well. But of course, topic is not everything, because just imagine if there is a top topic that we receive like 300 abstracts, we cannot do like 300 oral presentations. What's important here is also the ratio. For example, academic pharmacy and hospital pharmacy, but also, as you mentioned, community pharmacy from the special interest groups, PPR. Those are the ones that, those are the biggest ones that receive the most abstracts. And when we are actually letting people to give oral presentations, we are looking at that ratio. If one section receives 10 abstracts, and the other one received 300 abstracts, of course, there's a difference between the numbers that they can do oral presentations. Therefore, I am actually here encouraging everyone to submit their abstracts. If they're accepted, that will increase the number of oral presentations that we would like to give chance to, because more abstracts, then there's a more possibility that there is some really good abstracts that we would like to hear orally. Even if you cannot make it, for example, to the oral presentation, you will increase the number of submitted abstracts, which will increase the number of the accepted oral abstracts. So in here, I would definitely encourage everyone to submit. If the results are not there yet, that's not, of course, we are happy if we get some results, but that's not one of the priorities. Please state that your results are undergoing, and you can update these results by reaching out to me from congress@phip.org or ali@phip.org. And you can tell me that you have updated your results. Then I can update your abstract and use it with the updated version. But here, also don't forget that this is your federation. This is your Congress. This is your profession. So we're trying to be as encouraging as possible while we are also reviewing your abstracts. We're trying to create you a platform where you can actually showcase your work. And we actually learn a lot from that as well. Like when I am numbering the posters in the Congress area, I get amazed every single time with the amazing work that you guys do. So please feel encouraged right now when you close it, watch the webinar again, go just follow the steps that I did, log in, submit an abstract, and see what happens. So I think that would be all from me, Arinola, and thank you so much for the chance.
Thank you very much, Ali. Thanks very much for being here with us. There's having that background information. You can't buy it in the market, as we say in Nigeria. So I think we're into closing remarks. I don't know if it's possible, Ali, if we ask the attendees to put on their videos, would it be possible for somebody in the background to take pictures for everybody, or it would only be the panelists that will be captured?
Let me check if there's a possibility like that, Arinola.
Yeah. So please, can as much as you can you put on your videos? Let's see whether we can capture a picture of everybody. Panelists, attendees, put on your video as much as we can. Let's see if it's possible to capture us in a picture. Jonathan, you look like a ghost. Or maybe it's my internet.
No, I think it's from my side.
So if it's possible, and if there are more of you that know what you're doing, if you can help take those photographs, please capture as many photographs as you can of as many of us, even if it's only the panelists, but if you can capture the attendees as well, please, let's do that, because it's nice to capture such things. I like pictures. I think everybody already knows I like pictures. So please, let's do that. And while we're doing that, let me just thank everybody that has contributed to this very successful webinar. At some point, we had over 610 people on the call. I'll get the final details later, but it's a really encouraging number of people that attended this webinar. And I thank Rendani, I thank Mujahid, I thank Jonathan, Ali for sharing from your wealth of knowledge. People have been encouraged. People know that they're not the only one. For instance, I used to think that it was only in Nigeria that we were begging hospital and community pharmacists that you guys have data, do something with this data. But here I've seen that it's not only here, so when we gather together like this, we know that we have common problems, and then we can work together to solve those problems, So thank you very much for your thoughts. Thank you for putting together this very lovely webinar. And I don't know if there are any very last words from any of the panelists for the members. Words of encouragement. I'll start with you, Jonathan. 1 minute. Or 30 seconds, actually.
So just to encourage, especially the students, to work together. Let's collaborate. We learn from each other. So when we are learning, we have mentors, we have people who have the expertise. So we learn from our lecturers, our colleague students. Let's learn from one another and collaborate. Don't go on a solo path. You have a good research you are doing. Let people understand. Let them know how to help you. Sometimes the outcomes of your research can become the topic for the next person, and there should be a continuum. So let's work together. Thank you.
Thank you. Thank you very much, Mujahid.
Yes, yeah. So my would be that research and abstract is the best way of improving our practice. So as I said, find a question, find a challenge that you have, make it a question out of it, do a research, and come up with solutions that can better improve our practices in the hospital pharmacy.
Thank you very much, Mujahid. Rendani. Thanks very much. We really appreciated all the tips that you gave. Your last words, please.
Thank you. So last tips, maybe for the poster, if you can add a QR code something that a person can scan on to be able to access your full research paper if you've already published. And then maybe also provide small A4 pages with your poster in, just something that can be that the attendees of the conference can take with them to other if they cannot go through the whole poster at that point. So maybe just having that can also really help. But yeah, also printing on time, because if you do things last minute, then you might encounter challenges with printing big posters. So just do everything on time. I think that one has already been touched on, and make it look nice. So like I said, Canva has beautiful templates that you can also play around with, and there are multiple tutorials you can find on YouTube, and also to make it look nice so that the next person mustn't just pass it. It must attract them. And then I think lastly is to make it impactful. So there has to be something that is, how is it helping? How is it, what significance has it provided? So yeah, that's in closing what I can say, and all the best. And don't keep your research to yourself. Share it with the world. You never know what you can learn from the next person and what you can teach somebody else, especially since, FIP is all about uniting pharmacy globally. So knowing what other countries are doing and what you are doing, sharing that knowledge is the goal. So please do share your research. Yeah. Thank you.
Thank you, Rendani. Thank you so very much, everybody. So just last words to remind us that we're heading for Copenhagen in a few months, and this recording, as well as all past FIP webinars, can be found on events.fip.org, and that website. You'll be able to have access to the recording, listen to it again, watch the entire video again, and you'll be able to pick more things from it. Copenhagen, 31st August to 3rd September. Looking forward to seeing you there with your abstracts, with your posters, with your oral presentations, so that we can celebrate ourselves going forward. Thank you very much for attending.